Dental implants are titanium screws that are surgically placed in the bone. They are there to replace missing or severely damaged teeth or replacing a removable partial plate. It can be the best option for the right person. However, we see often some dentists offer this solution straight away, and this we believe is not the case, and they should be reserved as a last resort because any surgical procedure has risks associated with it, and if you have some risk factors to begin with, such as if you receive radiation for treatment of cancer, or if you have reduced bone quantity or quality, if you're a current smoker, or you have systemic disease such as diabetes, then you are compromised already. So we'll explore other alternative treatments such as a bridge or a partial denture, which may be safer or more cost effective, and they would be less problematic down the track. However, if we can treatment plan to find out whether you're suitable for implants or not, then we'll offer the dental implants, which are excellent solution for people who don't have natural risk factors. Provided that everything's done correctly, they are very safe. Early diagnosis and analysis is the key. So pre-surgical workup is important to determine the bone quality and quantity. This is to avoid damages to the tissues, any nerves, vessels, or sinuses, and this will ensure that these problems don't happen down the track. Some dentists will cut corners to reduce costs in both materials and treatment planning process. They don't have the qualification or necessarily invest in the process of treatment planning. Now, they may lack training in that. For example, I had a patient who recently came back from Thailand and presented with loose and painful gums, an implant. I had a look, I take an x-ray, and I found that the implant was placed in the gum rather than the bone. This is why the treatment planning is so important. In summary, providing the correct treatment planning, the implants have high success rates and are very safe. However, if it's not done correctly, they may cause further problems, maintenance issues, or even have to be redone. There are a number of factors. That's the reason some of the implants are cheaper than the others. The number one factor is whether the dentist invests in additional costs into the treatment planning. This eliminates the important things. It takes some time to take x-rays, scans, study models, and a surgical guide to ensure that the fixture is placed accurately in the bone. If dentists don't do this, it may be cheaper, but it actually compromises the treatment itself. So number two is that people use cheaper sourced materials from overseas, such as China, which may not come with a lifetime warranty or may not have the Australian standards, although they are cheaper, but they are of a lesser quality. Three reasons. Firstly, we are not a dentist who recommends implants for everybody. There may be safer or more cost-effective treatments out there, so we explore those first. Number two, we use the highest quality materials that are of Australian standards, which comes with a lifetime warranty. That means that if there is a problem in the future, there is no costs to repair or replace it. And number three is the treatment planning process, that we invest time and effort to take study molds, x-rays, surgical guides, so on and so forth. That gives you the best aesthetic and function. Unlike many other general dentists, I am qualified in dental implant dentistry, and treatment planning is a large proportion of that. Furthermore, I am in the process of studying and completing a mastery in dental implantology. So if you're interested to make a booking, we offer an implant consultation, which involves a thorough assessment of your teeth and gums, and we listen to what your needs are. And this dental assessment normally costs $150, but for a limited time only, we offer this consultation for free. So to schedule your appointment, please contact us today.